Renal obstruction can lead to kidney failure, stones, infections, tumors, previous surgery, and congenital malformations, and can lead to surgical correction. Calculi or stones made of crystalline minerals and salts are removed from their urethra and ureter to relieve pain and restore urine continuity. Kidney stones that are removed and sent to pathology must be sent dry. The goal of most procedures of the ureters is to restore continuity between the kidneys and the bladder, or at least to restore the flow of urine. Percutaneous nephrolithotomy, which is large stones in the kidneys or upper ureter, are removed percutaneously, which means through the skin, with a nephroscope. Typically, this procedure is done for extremely large stones. The patient is too large for extracorporeal shock wave therapy. The stone cannot be reached with an endoscopic ureteroscope, or the stone is infected, and this method allows for the drainage of the infected material. A list of terms to know. A nephrectomy is a removal of the kidney. It can be a simple nephrectomy with one kidney removed, a radical nephrectomy where the kidney and the lymph nodes are removed, and it could be a nephroureterectomy where the kidney and the entire ureter is removed. A heminephrectomy is the removal of the portion of the kidney. A simple nephrectomy and a radical nephrectomy can be done via open or the laparoscopic approach. Kidney transplants is the removal of a kidney from a living donor or cadaver and implantation into the kidney recipient. The kidney transplant is performed for acute or chronic end-stage renal failure. Ideally, the donor should be a close family member. Donors and recipients are matched as closely as possible with regard to cross-matching and histocompatibility. The ideal donor is young, free of drugs, free from infection and cancer. Both the live donor and the recipient can have these procedures done laparoscopically for a more rapid recovery. Adrenalectomy is a partial or total removal of one or both adrenal glands. Adrenal disease can often be life-threatening. This procedure can be performed both open and laparoscopically. Regardless of their approach, adrenalectomies pose the potential for hypovolemic extremes and post-operative metabolic complications.